Listen to this, okay? Most people has been asking me of the causes of infertility in male. It will interest you to know that about 8 to 12% of couples suffer from infertility globally. Multi-center study by the World Health Organization found out that about 20% problem comes from the male, while about 38% problem come from the female. Altogether, the problems that arises of infertility from both male and female count to about 27%. The 15% of the causes of infertility are unknown. So I'll just give you 6 causes of infertility in male. One is congenital. When we say congenital, it means a defect that comes from birth, okay? Another one is acquired or idiopathic factor, like it's not from birth, but the person may have gotten it due to one inhale or the other that was not diagnosed or they are not known. Another effect of infertility is psychological or social effect. For instance, for the men are exposed to so much hardship and stress, and sometimes lack of confidence, past trauma, past experience could affect a man's sexual life and function. Another one is environmental and lifestyle factor. I will list just 5 or 6 under environmental factor. We have exposure to toxin. This is also related to the social effect, which has to do with stress, with the kind of work men are exposed to. Example, like for the farmer, they use pesticide. Some they mine like lead and other mineral resources. Some are exposed to radiation and other chemicals in the course of their job or work. This could affect their fertility and also the reproduction of sperm cells. We have another one, which is drugs. Some antibiotics, that's drugs used to treat infection, and also drugs to treat diabetes and high blood pressure, even chemotherapy, could have effect in the production of sperm cell of a man. We have heat exposure. When a man has this constant or prolonged exposure of his genitals to heat, it can damage the sperm cell, and also it can affect the reproduction because it requires a cool and also an alkaline environment for the sperm cells to. Lifestyle, such as smoking, excessive alcohol intake, sugar intake, and drugs can affect man's reproductive system. We also have obesity, in the case whereby somebody is overweight and is not exercising. Most youth these days hardly even exercise, so this could be a contributory factor. The fifth one is medical condition such as hormonal imbalance, most especially the testosterone, because it's the basic or one of the sex hormones that help in sperm cells or sexual life of a male. We have genetic defects. We have infections such as chlamydia, gonorrhea, mumps, and etc. And in some cases, some of these infections they are asymptomatic, meaning they don't have sign or symptom. So you may carry this infection for long without even knowing. Okay, so this infection or this bacteria can even leave the urinary tract. For instance, in the case of urinary tract infection, they can travel down to the testes. Okay, and this could also affect the man's reproduction. Okay, so once in a while, it's good to go for medical checkup to check if there's any underlying infection that you may not know to arrest it earlier. Okay, we also have the enlargement of the veins around the scrotum. We also have undescended testicle, could be a factor. We also have anti-sperm antibodies or autoimmune diseases. Anti-sperm antibodies are your own personal cell dictating your sperm cells as foreign, thereby they'll start destroying it. In most cases, you tend to see that the sperm cell will be sluggish, their motility will be very, very, very low. Okay, and we also have drugs, as we've mentioned earlier, for chemotherapy and so on. We also have structural and functional problems such as ejaculation problem, blockage of the sperm duct, like the vas deferens, could cause infertility in men. We have sexual dysfunction, as we've mentioned, erectile dysfunction, which makes it difficult for coitus. We have damage of the reproductive organs. We have injury or surgery to the testicle. We have spinal cord injury. We have ancestry gland dysfunction. This all could affect the quality or the production of sperm cells in men. We'll talk more about the treatment and prevention of such, even though I've mentioned a few. For what you have been watching so far is a case of oligospermia, azoospermia, and normal sperm cells count. Okay, the azoospermia is the absence of sperm cell. The oligospermia is low sperm cell, and this could be due to blockage, okay, that won't allow the sperm cells to come out completely or to leave the body. We'll discuss much more better. And for people that have the eagle eyes, the oracle, I'm talking about the scientists, they will understand this feel better. Okay, so there was absence of sperm cell, there was low sperm cell, and then we have the normal sperm cell, and that's what I started with, and that's what I've ended up with, because that's what we want to achieve, to have male that could produce normal sperm cell with the help of knowledge and technology of science. Okay, so enjoy, and in case of any question, feel free to drop it at the comment section. If it's so pressing or private or personal, you can just DM me anytime I'm chance. I reply to your message. So let's dig in. This is a stained sperm cell, but they are not much. This is a case of oligospermia. Okay, why do you think oligospermia could be a factor in fertility? Because the semen needs to accompany the sperm cell to help it in motility. Yeah, stop there. That's right there. That's a case of azoospermia, no sperm cell in that field. Only few bacterial cell and epithelial cell that are there. This is a stained sperm cell. It's quite much. This stained sperm cell normally we check for viability and non-viability of the sperm cell. Scientists, thank you so much for doing wonderful. And then here we go, the healthy ones. Yeah, the goal shooters. Even though they can be this healthy, this active, this progressive, but you could see that some may have a